I was asked to introduce Dr. Miles Weinberger today. Dr. Weinberger is Emeritus Professor of Pediatrics at the University of Iowa and a visiting Professor of Pediatrics at the University of California, San Diego. Do you hear an echo when I talk?
No.
No, okay.
Yep.
I'm hearing a terrible echo. Okay. So Dr. Weinberger started the pediatric allergy and pulmonary division at the University of Iowa in 1975 and chaired it for most of his 40-year tenure there. He has authored numerous journal articles and textbook chapters and has given hundreds of invited lectures in the United States and foreign countries. Dr. Weinberger has spent recent years teaching both adult and pediatric physicians about diagnosing and treating habit cough. So I'll turn the floor over to Dr. Weinberger to talk about cessation of unexplained refractory chronic cough.
Cessation of undiagnosed and refractory chronic cough. Leslie, is everyone seeing this? Hello? Anyone here?
Yes, I can see your slide.
Okay, good. What I'm going to do first, hopefully, if this had problems with this last week, is show you some videos that parents and patients took at home.
There you go. It's working.
Here I go. Good. Okay. This is a 10-year-old boy. He had chronic cough. His daily for more than a month. Present during most waking hours. No cough when sleeping. Here's another one. This is 11-year-old Aryan from Mumbai, India. Regular episode. Cough a day. Cough and sleeping. Here's a 36-year-old man from Germany. Sleep is coming through. Is it coming through?
Yes.
Good. Okay. And here's a 60-year-old woman from Cleveland. She's been coughing for 2 years. Again, both of these are absolutely sleeping. So, just want to move something out of it. There's other things up here. It's possible for seeing it. So these patients all have an involuntary habit disorder. So daily, repetitive, involuntary, non-productive cough, absent during sleep, which is sine qua non of this disorder. Habit disorders, according to the American Psychological Association, are involuntary behaviors Sorry, I keep getting something here that keeps getting in the way. Okay. Involuntary behaviors that become disruptive and cause distress. Just some of the involuntary behaviors that fit the category of habit disorders or tics. Things, I'm not going to try and pronounce all these names, rhinotoxicomania, compulsive nose picking, compulsive nail biting, compulsive hair pulling, and it kind of made up this term to fit the same pattern as compulsive coughing. So this is essentially the habit cough, which is fits the category of being a habit disorder. A daily, repetitive, non-productive cough that is absent during sleep. So habit disorders, just to go over this category again, repetitive unwanted behavior, they're involuntary, cause distress, functional impairment, physical and social consequences. And then if you look at at what happens with habit cough, it fits the habit disorder perfectly. So habit cough is one of the habit disorders. Now, this is not a new disorder. It's been known, in this case, for thousands of years. Tiberius had taken a medicine for a habitual cough, it was described, which was continually growing most. Here's from 1685, a violent dry cough following her day and night, unless when she was sleeping, unless she was falling asleep. So it fits the description of today. And here's one from 1694, where they talked about a habit cough, which began with a cold, and the cold went away, but the cough continued. That's what they call a habitual cough. So this has been known for a long time. Here's from the 19th century, Charles Crichton, British physician, described a habit cough, a reflex effect persisting after the cause is gone, or an acquired habit, he called it. The treatment of it is to break the habit, which was a lot of foresight, and that eventually is how this is cured, to break that habit. So this insightful statement to break the habit is the crux of current treatment. So who gets habit cough? Well, at the University of Iowa, when I was there for 40 years running the Pediatric Allergy and Pulmonary Division, we looked back over one period of time, and we were averaging about 9 children per year, which interestingly is exactly the same that the Brompton Hospital in London described. They also, over a 6-year period, described 9 children per year. So this is probably a minimum estimate of what might occur at pediatric centers that see children. I'll show you some of the publications later. But also, in addition to children, which is what we first studied, we have now become aware that adults with unexplained refractory chronic cough also get the habit cough. And this was first described by Dr. Hake in chest, and then we published the first 20 of these patients in this publication in the Annals of Allergy, Asthma, and Immunology. Now, what do we know about why it occurs? We don't know why it starts, but there's generally a history of some respiratory infection, just a cold, ordinary respiratory infection, just as in some of those early reports in the 17th century. But what we do know is something about what keeps it going once it starts, and it has to do with inflammation. This study by Richard Irwin, using bronchoscopy, got samples of the airway mucosa in patients who had this cough, and he showed that there was inflammation there, And based on the evidence that he had from comparing with other patients, he concluded that the inflammation was likely caused by the coughing itself. And then a more recent one in the Blue Journal, Shapiro and authors in 2021, just 3 years ago, showed with special stains getting mucosa in the same way by bronchoscopy, showed that there was increased nerve density. So what you have is essentially a type of neuropathic inflammation, which is caused. He also felt that this was, Shapiro also felt this was caused by the coughing itself. So what you have is a type of neuropathic inflammation, which is caused by the repetitive coughing. And that neuropathic inflammation also causes the repetitive coughing. So what you have is cough causes a lesion that perpetuates cough. So we have been treating habit cough in children since probably over 50 years ago. And for the past 6 years in adults. How? Patient learns to not respond to that urge to cough. This isn't something they do automatically, but they can be taught to do it. Method involves what is called suggestion therapy, which is simple behavior technique. Bernie Berman was a pediatric allergist in Boston. In 1966, he published this article where he cured these 6 children that he had seen with a cough, like I demonstrated at the beginning, and he used the technique that he called the art of suggestion. Suggestion has been studied in the psychology literature, and this is one of several studies that I've got that shows that that suggestion can affect body type things. In this case, we studied pain, itch, and fatigue. And we've shown that suggestion therapy can stop coughing by direct contact, which of course we got in the clinic, by teleconference, which I'll show you, and also I'll show you the data of patients watching a video of cough cessation. So this was the data I showed you from Bernie Berman, the art of suggestion. He considered what to call these patients, these 6 children that he saw over 5 years. He considered those people had coughed, described single case reports that they called psychogenic or tic. He felt based on these patients had no psychological abnormalities. They had no other tics. And so he felt the diagnosis of habit cough was most appropriate, and that's been the term that I continued. So here's our very first study from 1991, outcome of a habit cough in children treated with a brief session of suggestion therapy. The index case was a 15-year-old girl with months of intractable cough. Cough stopped within 15 minutes of suggestion therapy. My fellow Dr. Doris Bakshin, it was the first time he'd seen that done. I mean, he said, that's very impressive, but is that fixed permanent? Well, as the mentor, I got Dr. Bakshin to do what fellas should do, and he said, look and find out. So he reviewed back manually 9 children with the habit cough, and they'd been contacted routinely 1 week later by our nurses. 1 had no symptoms at 1 week, and 8 had minor self-controlled symptoms. And Dr. Bakshin contacted them an average of 2.2 years later. 7 of them he was able to find and 6 had no symptoms. 1 had minor self-controlled symptoms. The other author, Dr. Lindgren, was a psychologist in our department, and he gave these parents what is called an FCL90R test, which tests for other aspects of psychopathology, and they were all normal. And then in 2016, we published this article, which was where we looked back over our patients that we had seen over a number of years. There were 85 that were coughing when we saw them at the clinic. 81 of 85, the cough stopped within 15 to 30 minutes of suggestion therapy by whichever clinic physician was scheduled to see them. These were not all me. And then we provided auto-suggestion to all those, which we called it auto-suggestion because we had them do at home in practice sessions exactly what we would do in the clinic in those 15 to 30 minutes periods. Now, what influenced eventually our ability to and our knowledge of what was happening in adults, and described what happened with a 12-year-old daughter that father called me, she'd been coughing for 3 months. We provided suggestion therapy by teleconference. It was done by teleconference because she was 2,500 miles away from me. And this was the first time I'd done it by teleconference. Unfortunately, the result was the same as with direct contact in the clinic. We had some interesting views from some cough specialists who had published a lot in the literature. And one of them said, Alan Maurice said it was that what we saw really was just a form for us of Tourette's syndrome, but she had dealt with her such symptoms. Another expert that you'll see in literature is Peter Dispidagasis, who said that I was performing a type of psychoanalysis to get her to cough. I don't know psychoanalysts. I'm not a psychoanalyst. I'm just a pediatric pulmonologist. And this was not psychoanalysis. So this is a demonstration video of what I was doing with that girl.
You did it for over 3 minutes.
It's just a demonstration.
Did it get a little bit easier that time?
Portion of it.
Still hard though, huh? Okay, we're gonna go for 4 minutes now. Yeah. Okay. You're doing it. You're doing great. You went 3 minutes before you coughed. Mm-hmm. So I bet you can do 4 minutes too. Because you're taking control. You're not letting it control you.
The full version of this.
So this is what you have to keep doing.
Is on.
You may have to do it for a while.
It's on the web.
It's going to gradually get easier. Gradually gets easier.
It's on YouTube, and this girl's father put it on his own website that he eventually called howtocough.com. And these are a couple of websites. This is the YouTube address, and if you can't see it now, I can give it to you later. And habitoff.com was her father's website that he put on. And that includes what he calls a Habitoff documentary. He's accumulated a lot of what we've done since then. Now, something interesting happened when he when he essentially made that publicly available on YouTube and his own website. And we found that suggestion therapy would be effective essentially by proxy, by just people watching the video of me providing suggestion therapy. And we published that result. And we got emails from parents of children, but also from adults who had the same, who related to it, said it's exactly the same thing I've got this type of cough, and it only goes away when I'm sleeping. So we call that essentially suggestion therapy by proxy. And this is one description. I'm just showing it as an example. He says, I'm a 30-year-old male who suffered a chronic cough for almost 2 years. In that time, I saw numerous doctors, took many medications, had many medical procedures done in an attempt to stem the cough, all to no avail. He said, I found the website, watched Bethany with me. I followed the procedure and saw the effects almost immediately. He says, I am truly amazed that such a simple procedure at no cost, with no medication, can be so effective. And this is after 2 years. I have many, many like this. This is what we've seen over the last 6 years since we've had that video online for people to see. And what you see is the red markers are children who have been influenced by, the parents tell us the child was influenced by that video, and the blue markers are the adults. We have an interactive version of this. Okay. And it shows, it identifies each of these patients. 60-year-old woman cured by the proxy. And here's a 9-year-old girl with 24 months of habit cured by a Skype call, by me talking with her. And you can go to this and look at yourself. There's a 10-year-old boy cured by watching the video. And here's a 29-year-old also cured by watching the video.
Mike, the map is not on the screen. We're unable to view the map. If you could drag it on the screen.
You can't see it?
No.
Okay. Well, you see this?
Yes.
This is what happens if you don't diagnose and treat habit cough. Mother sent me from a 10-year-old boy with greater than 6 months of chronic cough, and she said, "Here's." She sent this to show what all had been prescribed and given to the poor kid, and his coughing stopped by suggestion therapy. So, daily repetitive dry cough absent during sleep is a habit disorder known as the habit cough syndrome. It occurs in both children and adults. It can last for months or years. In some, it stops after many months and returns. This is one thing we've seen in both adults and children. Not in all of them, but some of them have it last for months, and it stops on its own, with a spontaneous remission. But then when they get a cold, it starts up again. And I've talked with a number of adults who have this, and I can There was one lady by the name of Gracie Terzian, who has her own blog, who describes this very nicely. So habit cough responds to no pharmacotherapy. It's useless to prescribe anything when you see this pattern of cough. Suggestion therapy is effective by direct contact, by teleconference, and by watching a video on YouTube of me providing suggestion therapy to a 12-year-old girl. So, time for questions. Hello, everyone still there?
So do you just assume that if a person has a cough only during the day, it's habit cough, and you don't do any further workup and just do suggestions therapy? Or do you make this diagnosis after you've done some evaluation?
Well, I think it's reasonable to get spirometry and a chest x-ray. One, the patients like to feel that you've looked for any organic cause. And two, if you have a normal spirometry, a normal chest x-ray, and they have this pattern of repetitive dry cough that is absent once asleep, it's 99% likely to be habit. What else could it be if that pattern?
This is Natalia. I was thinking, did you ever do a trial of any steroid or bronchodilator?
What do you mean by therapy?
No, inhaled steroid or a bronchodilator.
Sorry, say that again.
She said, have you tried, what about using asthma therapy like bronchodilator or inhaled corticosteroid or even systemic prednisone?
If you want to accumulate a lot of stuff like that mother of the 10-year-old boy, that's what's going to happen. If you raise the question of asthma, there's a study going back 30 years that showed just give a 5-day course of prednisone. If it goes away, it's asthma. If it doesn't go away, it's not asthma. It can be a very simple measure, but don't start giving inhaled steroids and other asthma medications until you have a diagnosis of asthma. And the diagnosis of asthma can be determined by a short course of prednisone. That was shown by the Northwestern group almost 30 years ago. We don't have to repeat what someone else has done, but it was so convincing to begin with.
What would be the effective bronchoprovocation, like with methacholine or mannitol?
Whatever the result is, it's of no interest. I mean, there are normal people who have positive methacholine. There's studies showing it happens with people who just have allergic rhinitis. It also happens in parents, asymptomatic parents of children who have asthma, which suggests that airway reactivity is inherited. But why do that? If you have the clinical pattern is such that is generally sufficient to make the diagnosis. You get the routine bronchoscopy, the routine spirometry and chest x-ray as a screening test. And if you have, and again, if the patient is productive or has an abnormality on either of those, well, then you follow up and evaluate it. But if there's no, it's very unlikely. It's so unlikely that it's just not worth considering. That if the spirometry and chest x-ray are normal and the patient has this pattern of coughing all day like you heard, but they don't cough once they're asleep, What organic cause does that? I don't know of any. Whooping cough could certainly cause cough, like you heard, but the worst part of whooping cough is it keeps occurring during night when they're sleeping. Cough occurs also, or symptoms occur when they're sleeping with asthma. So the diagnosis can be made with simple screening to be certain that there's no underlying disease and that clinical pattern.
Have you ever tried gabapentin? Have you ever tried gabapentin?
Why do that?
You had proposed that the mechanism was from neuropathy within the lungs from inflammation.
The mechanism of it continuing, yes, which has been caused by the cough. So I would go along with what Charles Crichton said in the 19th century. What you want to do is break the habit. No medication is going to break the habit. And all of these patients, I've talked with so many of them, have had so many medications, so many procedures, and they, some of them have to do a fair amount of practice for a few days before they can control their cough. Others stop coughing very quickly after they watch the video. A large part of it is just the patient realizing that it can be done. And then they start learning the urge to cough. The urge to cough is very strong, makes them want to cough. But they can learn to not respond to it. That urge to cough continued, for instance, in Bethany, the one you saw the video of, she continued to have an urge to cough for almost a month. And I talked with a 24-year-old lady from Singapore who said she stopped coughing after watching the video. But the urge to cough was there. She said it was at 3 weeks she started having an occasional day when she didn't have the urge, and it was 4 weeks before the urge was gone. So it really acts like there's that urge to cough is a neuropathic inflammation in their airway, which is what they're feeling, and they learn to not respond to it, and then gradually the urge goes away. It's just a waste of time to do, studies beyond the screenings, spirometry, and chest X-ray. And that's one of the ways that most of these patients suffer. I mean, it's a miserable life to, we had one patient said they spent $10,000 on going to doctors and medicines, and he stopped by watching the video, which taught him, and he said it had imitated me, and just did the same thing, learning to not respond to the urge that is there. It will be there for a while. Patients with Bethany, you can see her in the whole video continuing to struggle, but not letting it happen. Because if the cough starts and it's going to perpetuate, coughing causes the inflammation that causes the cough. It's a vicious cycle that has to be broken.
Is there any information of whether there's inflammatory cells involved in this inflammation? Like eosinophils?
Well, the only data we have is Richard Irwin's study that used just an H&E staining showing inflammation. And then the one from 3 years ago by Shapiro et al. Showed increased nerve density. I don't know of any studies of the nature of the inflammation. Well, all we know is what it looks like on H&E staining, and that special stain that Shapiro's group used to look at the nerve density. What difference would it make? What inflammatory what inflammatory types are there? I think that's sufficient. The evidence is the cough causes it. So, talking to the group here, do you see a lot of, how many adults do you see with chronic unexplained cough? Is this a common problem?
It's a very common problem.
And do you stop them from coughing?
I think we often are frustrated with medicine. It's not working.
Yeah, nothing works. I mean, the tradition is due to GERD, gastroesophageal reflux, or upper airway cough syndrome, postnasal drip. I attended a cough conference, American Cough Conference last month, and there are apparently two different schools of thought among the experts, besides my school. A lot of people who, and Richard Irwin is one who, feels that you treat for gastroesophageal reflux and for upper airway cough, for postnasal drip. But you can't find a controlled study that shows any of those are effective. And what the other group says, no, the major thing is a cough hypersensitivity that is there, and those other things are just triggers. And so there's no point in treating those, because none of the traditional treatments that Richard Irwin has said for 30 years now, cures the chronic cough, because the chronic cough is inherently due to cough hypersensitivity, and that's something that Wu Young Soon has written about extensively, and also Alan, what was his last name right now?
Morris.
So there are lead people, top people who there's these two different schools of thought. I've got another article that I just submitted, an editorial I was invited to write. That still hasn't been through. You have to go through the review process yet, but I'll send that out for people to see, because it goes into this conflict that others have about this. So, any other questions?
Dr. Weinberger, tell about the gentleman named James from London with the 45-year cough. James from London with the 45-year cough.
Oh, yeah, that was a recent email we received. He had been coughing since he was a teenager, so it had been going on for 45 years. And the first thing that ever helped him was watching the video. And the last email we had from him said the cough is 90% gone, and he's working on the last 10%. Essentially, these people that have this, as I said, the urge to cough continues. So sometimes when their mind is somewhere else, it might start up again, and they have to again get control. I tell them to get off on their own, and for 15 minutes concentrate on not responding to the urge. That doesn't make the urge go away. I said the evidence we have is that the urge, which is that neuropathic lesion, that's the urge that they feel. Often patients call it their tickle or irritation that makes them cough. That obviously takes a while to heal up, but they can learn to not respond to it, which is not a natural thing. If you feel an urge to cough, you want to cough. And the more they cough, the stronger that urge gets. But they learn to break the cycle. They learn it can be done because they've seen it done. Other questions? How many, after seeing this, well, what should people do? What should you do if you see the next patient? You get a history. When you listen to the cough, is the cough dry, non-productive? And then ask, and this is what a lot of the studies haven't done, is it there when they're sleeping? You might have to ask their sleeping partner in some cases. You would be more aware of whether or not there's coughing while they're sleeping. And again, you need to differentiate the patient who wakes up, say to go to the bathroom and coughs. That's different from the patient who has coughing that wakes them. So if coughing wakes them, it's something else. If coughing doesn't wake them, and they have the type of pattern that you've seen in the videos I showed, then your spirometry and chest x-ray were normal, you've got habit cough. And that, I think, is the majority of these patients who are
I love you guys.
who don't have an explanation for the cough, and who haven't responded to medication. Usually by the time you see them as a pulmonologist, they'll have had other doctors who have tried to give them something, medications, so they haven't responded to it, so they're refractory. Then you've got a diagnosis of the habit cough. And the first thing you should do is have them watch that video. And so I've had physicians, mostly pediatricians up till now that I've talked with previously, pediatric pulmonologists, I should say, who have the patient watch the video in their office and then talk to them about the habit cough. So there's a cognitive portion. The patient needs to know what this is about. They need to see it happening, and once they see it happening, they can imitate how what I was doing with the child. So I recommend that's what you do with the next chronic cough. You see, get the information. Does it go away when we sleep? And take all the guidelines for chronic cough you've ever seen and throw them away. Because I was on one of these guidelines from chest that Richard Irwin was running, and they just keep saying the same thing over and over again for 30 years. Any other questions?
Thank you very much for taking the time to share your thoughts with us.
Okay, I will send this recent submission that I was asked to do that provides some of the conflicts between different people who have been writing about habit cough in the past. So essentially there's conflicting views, and now there's a third conflicting view, which is mine. Okay, well, thank you for listening. If anyone wants to contact me directly, I'm happy to talk with anyone. So you've got I think Leslie has my email. You can share it with anyone. And he also has my phone number. I'd be happy to talk with anyone. So
much.
Go cure some cough first. Bye.
Okay, thank you. We have clinic this afternoon, so we'll see if we come up with anyone.
A journey of 1,000 miles begins with one step. The repetitive barking cough that is not present once the child is asleep is the diagnostic criteria. While cough may interfere with falling asleep, the cough gone once asleep is the diagnostic sine qua non for this peculiar disorder. I have no idea what it comes up.
Hi, I'm Bethany. I'm 12 years old. I could do anything any kid could do before my cough. When I couldn't stop coughing, it made me really sad. Dr. Weinberger taught me how to make my cough go away in only 10 minutes.
Yeah. I told you, right? The total number?
Yeah. We don't want to keep count of them. We just want to.
No. She was tell Hunter. Shh, tell him, look. We kept a precise diary of every event during this horrible time. We're releasing it out onto our website so that anybody can look at it also to see if they feel that they fit the criteria of this terrible habit cough. We eventually ruled out everything, working with our doctors, trying to figure out what this was. One of our doctors early on said, "Tell your body to stop coughing," but that's all she knew. There was no other information available at the time. As you see here, we ruled out basically everything over the counter, and we even looked at GI, reflux. We even checked her saliva, which wound up to be in a good range. We were at wit's end. We didn't know what to do. Then after 3 months, we had a huge find, habit cough in adolescent children by Dr. Berman. And it was such a relief. We're like, wow, somebody knows. Through more research, we wound up tracking down Dr. Anbar out of Upstate University Medical. And I sent him an email, and he was the first person to mention Dr. Miles Weinberger. As luck would have it, I found Dr. Weinberger's email address. I sent him an email with our diary, asking him if it might help him in some way. He actually sent me an email that I saw right when I got home, and he said, "Call me tonight." And he had this awesome paper, The Habit Cough, how to diagnose it and to treat it. We were blown away. He actually said, "Call me." I called him, and he asked, "Does Bethany wake up with the cough in the middle of the night?" I said no. He knew right then and there that it had to be habit cough. We arranged for him to Skype 2 days later. He wanted Bethany to be there with a glass of water, ready to concentrate. What you're about to see shocked and amazed us. I planned on recording audio only, but about 3 minutes in, I realized something really incredible was happening. I picked up my wife's phone and I began to film because no one would believe what we were about to see.
Great girl. You've done it. Over 3 minutes. Hey. Don't. Once you cough once, try not to let it happen again. Try and hold it back because that causes more irritation and makes you cough more. But you did it for over 3 minutes. Okay. Did it get a little bit easier that time? Still hard though, huh? Okay, we're going to go for 4 minutes now. Yeah. Okay. You're doing it. You're doing great. You went 3 minutes before you coughed. So I bet you can do 4 minutes too. Yeah, you can do it. Okay. So just keep thinking, keep concentrating. Yep, you got to concentrate because you've got to be aware of what's making you cough. Because it's kind of automatic, but it's kind of like breathing. You don't have to think about breathing, but you can control your breathing if you want. You can hold your breath, you can breathe more. Right? Remember what I said, you start feeling that, take a slow, deep breath, because it helps a little bit too. And in addition to sipping a little bit of water. Great. Great. Have you ever had a mosquito bite? No? You never had a bug bite? Never had anything on your skin that itches? You ever noticed that the more you scratch it, the more it itches, and you have to stop scratching it? This is kind of the same thing. The more you cough, the more it causes that feeling back there that you have to cough again. And just like you have to stop scratching something in order to heal up and stop bothering you, you've got to control the cough, which is harder than not scratching. I'm not saying this is an easy thing to do. If it was an easy thing, we wouldn't be here. It's hard because it goes on and on and on. But what you're doing is learning to hold it back, even for a little bit. And the longer you can hold it back, the easier it's going to get. You've gone almost 3 minutes now. Almost. And you get 1 more minute. Okay? The longer you can hold it back, the easier it's going to get. But it's hard to do. It takes a lot of concentration. Don't let your mind wander. Your mind wanders, and this automatic cough's going to come again. So you got to keep thinking about it. Kind of boring, but it's important. Hang on there. Keep thinking. Yeah. Slow, deep breath too. Slow breath. Good girl. Hi, girl. You're doing great. Another 20 seconds, you'll have gone 4 minutes. Okay. Slow, deep breath. Control that annoying feeling. And that feeling has occurred because of this very long period of you been coughing. I'll look back. Okay, you've gone 4 minutes. You're doing well. Hang in. Keep concentrating. Keep concentrating. Guys, we're going to go 5 minutes next. 5 minutes. Slow breath. Relax, but keep focused on me and think of nothing else but being aware of it before it coughs. Be aware of what you're feeling before. And when you feel it, take a slow, deep breath, take a sip of water, but keep controlling it. Good girl. Good girl. Okay. Take slow, deep breaths, relax, and just keep listening to me and stay focused. Think of nothing else. Okay? You're going to do 5 minutes, and I'm sure you can, right? Because you did 4 minutes. If you can do 4 minutes, you can do 5 minutes, can't you? Right? You can. But it takes a lot of brain power to do that, doesn't it? Yeah, I know. It's hard. Okay? So you keep thinking, keep concentrating, take some slow, deep breaths. Real slow, real slow. Real slow. Very slow. Relax. Stay relaxed. You're doing great. You're doing great. Stay focused. Keep your eyes on me. Don't look anywhere else. Don't think of anything else. You gotta keep your mind working on one thing. On one thing. And that's not responding to that feeling there. I'm not gonna do that. You're doing, hang on. Good girl. Good girl. That's right. That was hard. You're feeling it there, right? Take slow, deep breaths. Slow, 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 slow. Great. Okay. Concentrate. Keep your mind focused on that one thing. Don't think of anything else. You're getting all your brain power on one thing, because you've got a lot of brain power, but usually it thinks of a lot of things. So right now you're not letting it go anywhere else except concentrating on when you feel that. Hold it back. Take a deep breath. Sip a little water. Yeah, that'll help. But the main thing is using your brain to hold it back, to control. You're going to take control. You're not going to let the cough take control. Because you're smarter than the cough, aren't you? Yeah. You're doing great. Hang on. It's hard. It takes a lot. Hold it back. Good girl. Good girl. Hard thing to do. So, you really have to concentrate. Okay, you're doing well. You're doing well. Okay. But the longer you go, the easier it's going to get. The longer you can go, the easier it's going to get. Okay? It's still going to be there. It's not going to go away completely. Not for a day or so, because you've coughed for months. So you've irritated it back there. You've bothered it. And that's what's causing the cough. But if you can stop it from happening, it's gradually going to heal up. And you won't have to cough like you have been. 20 seconds, it'll be 5 minutes. Hey, you can go that much longer, can't you? Yeah. Okay. Yeah. Okay. Feeling it now, but take slow deep breath. Slow deep breath. Good, you're good at this. I can tell you're good at this. Hey, you've gone 5 minutes. You've gone 5 minutes. We're going for 6 minutes now. Okay? You've gone for 5 minutes. Still there, right? Okay? Slow deep breaths. Slow deep breaths. Okay? Keep concentrating, because the longer you go, the easier it's going to get. It's getting a little bit easier now, isn't it, to hold back? I saw it was going to come out there, and you did a good job of holding it back. And that's what you got to do. Your brain has to be the boss here. You have to be the boss, not the cough. Cough is kind of automatic. It just happens without you thinking about it. But if you think about it, you can hold it back. Not easy, but you've been doing it. You've done it for 5 minutes, and we're going into 6 minutes now. Okay. Keep concentrating. Think of nothing else but holding back. Think of nothing else, and take slow, deep breaths when you start feeling anything. Good girl. Hey. Hey. You're going to send that cough packing, aren't you? I'm sure you will. Okay. Now that feeling isn't going to go away completely, but not for a day. What you're doing is learning how to take control and not have it keep going. Because the more it coughs, the more it's going to cough. The cough causes the cough. So if you can hold back the cough, if you get your brain to do that, it's going to gradually get better. You're doing great. Nice slow breaths. Relax, but stay focused on me. Keep thinking of nothing but the cough, not the feeling that you're holding it back. The feeling of holding it back. And you keep holding it back. Okay, keep doing that. Getting the feeling, take a slow, deep breath. To relax. Slow, deep breath. Keep looking at me. Slow, deep breath. Great. Okay. Keep focused. Remember, it's the cough that's been causing the cough. The cough causes more irritation there, and it's irritation that makes someone cough. And so you have to break the cycle. You have to break the cycle. You're doing great. Keep holding it back. Keep holding it back. Slow, deep breaths. Keep concentrating. Yeah. You're doing great. You're very good at this. You're very good at this. But it's working, isn't it? You're able to hold it back longer. Each time, you're able to hold it back a little bit longer. Okay? And we're going for 7 minutes this time. 7 minutes, and you're doing it. In 7 minutes. Great. Keep concentrating. Very boring, I know. Just have your mind on one thing. But it's important, because that's the way you get control of something that your body wants to do. And that's what you're doing. You're taking control. You're going to say, yes, I've got that feeling that I have to cough, but I'm not going to let it happen, because I'm the boss. Okay. Slow, deep breaths. Slow, deep breaths. Right. Keep concentrating. Great, you're doing it. It's fantastic. Fantastic. You're really good at this. You're getting there. You're getting there. Yeah, because the longer you go, gradually it's going to get easier. And it's getting a little easier, isn't it? It's not gone yet, but it's getting a little easier to hold it back. And that means your brain is controlling it instead of just letting it happen. Okay? Good girl. Good girl. Okay? Yeah. This is not a real common problem that you have, but you're not the only one in the world that's at it.
Mm-hmm.
I've seen a lot of other kids with this. Used to be about 7 a year in our clinic, so that's not common, but it happens. Okay. And this is what you have to do to get it under control, to get your brain to take control of what your body is trying to do when you're not thinking about it. Okay. Slow, deep breaths and concentrating. You've gone 7 minutes. We're going for 8 minutes now. Okay. You're getting there, aren't you? Yeah. Feeling you've got a little more control over it now, huh? Yeah. Okay. So we're going for 8 minutes. Great. Just hang in. Keep concentrating. Keep saying, I can control that. I can control it. I can feel it, but I will not let the cough happen. I'm just not going to let it happen. I'm not going to let it happen. Take a slow, deep breath when you need to if you feel anything. Good. Yeah. You're doing great. You're on your way to an addition to the 7 minutes. And you did 7 minutes in addition to 6 minutes. So you've done 13 minutes already. That you've held it back. Yeah. And you're going to keep doing it. Because the longer you do it, the easier it's going to gradually get. The longer you do it, it's gradually going to get. It's not going to make it feel it go away right away. It's like a bite that you've been scratching. It takes a while to heal up. But until you stop scratching, it doesn't heal. It's the same thing until your brain learns to control that cough and not respond to that feeling. It's going to keep happening. Good girl. You're feeling it now, huh? I can tell. I can tell when you're feeling it. And that's when you've got to really concentrate. That's when you've got to really concentrate. Yeah. Slow, deep breaths. Slow, deep breaths. Slow, deep breaths. You know, when you add up the different times, it's getting to be over 20 minutes since you coughed. And that shows you can do it, right? Not easy. We're going to go longer because the longer you go, the easier it's going to get. The longer you go, the easier it's going to get. That's what you have to be thinking about, because you're controlling it. It's not controlling you. You're the boss. Your brain can control it, not just respond to that feeling. Okay, good girl. Okay. You're doing fantastic. You're really doing well. Feeling is still there, but you've gone more than 20 minutes controlling it. We'll keep going a few more minutes because I want you to keep controlling it. Because keep in mind, you're the one that's controlling it. I'm not doing anything except teaching you what to do. You're the one doing it, which means you can keep doing it even if I'm not there, right? I think you can. Because what we're doing here, you can do on your own later if the feeling is still there and starts bothering you. And if you do this, if you keep thinking about it, again, the longer you go without coughing, the easier it's going to get. And after a day or so, that feeling's going to go away as it heals. Like a bite that's itchy, you just got to heal up. It takes a little while. So keep some water around. Keep some water by your bedside. And remember the slow, deep breaths. When you're feeling something, you do something else other than coughing. You say, I'm not going to cough. I'm going to take a deep breath. I'm going to sip a little water. I'm just not going to cough. Okay? Because you can control it, right? You've been doing it. So you know it can be done. You know it can be done. And that means anytime it starts happening, you think about it. You can control it. It's when you're not thinking about it that it happens by itself. You're still feeling it, but you're controlling it. Remember the slow breaths too. So, again, that nasty feeling is there, huh? But you're controlling it now. It's not controlling you. Okay? You've gone almost half an hour now. I think you can keep doing it on your own now, can't you? I think you can. Yeah. So what I'm going to do now is I want you to keep thinking of your own. Okay? Keep thinking on your own. Okay? Slow breaths. Okay. Don't let that feeling make you cough. Because you know you can hold it back. You've done it. You've done it for half an hour. So you can do it. Not easy. But you're showing you can control it. Okay. 6 slow breaths. Slow, deep breaths. It's bothering you, isn't it? Yeah. But you're controlling it, even though it bothers you, because you're taking control. You're not letting it control you. Okay? So this is what you have to keep doing. You may have to do it for a while. It's going to gradually get easier. Gradually gets easier. Keep thinking about it. Hold it back. Good girl. Keep looking at Mill when you and take a slow deep breath. Slow deep breath. helps a little, huh? Taking the slow, deep breath. Okay. Okay. I think you can do it yourself for a while now, can't you? Okay. Let me talk to your mom and dad, but you keep thinking by yourself. You keep control. Mom and Dad, are you there?
Yes. So here we are, Dr. Yim's office. What did we do today? And she can't talk a whole lot because she's still still recovering. So yeah, and she has to cough right now. And hold on. What do you do? Do that.
Don't cough.
Right? Great job. Let's walk. So we're going to go and have a treat. So Dr. Yim was wonderful. You did a great job. No, I don't want you to. Dr. Wine? No, try not to. No, try not to. Take it. Do one. All right, what? One more minute. Hold on. I'll tell you when time's up. Take a sip of water. One more minute. I'm always going to say one more minute. Okay. You're allowed to do a couple extra. That was only 6. Normally it's 12. Still good. You cut it in half, okay? Good girl. How do you feel? Ugh. So Dr. Weinberger said, just shave off a little bit, basically. That's my words, but he said if you're going to cough 12 times, only cough 6. And then you cough 5. What you doing?
Taking my medicine.
What's your medicine?
If you start feeling anything,
Oh, great.
Thank you for teaching me how to make my cough go away, Dr. Weinberger. If I can do it, you can do it too.
On our way home from Dr. Yim's visit, Bethany saw the sign and yelled, "Daddy, turn around." Wow. Follow your steps and drink your water, just like Dr. Weinberger said. Dr. Miles Weinberger, you certainly are miles from ordinary. The goal she reached is to be a flower girl in her friends' weddings and more.
My full session with Dr. Weinberger is on our website at habitcough.com.
Please be advised, this was our experience with Dr. Weinberger. Yours might certainly differ, but talk to your pediatrician, talk to your pulmonologist, talk to your child's doctor, and let them know about habitcough.com.